And joining us now is Dr. Amish Adalja, Senior Scholar at Johns Hopkins Center for Health Security. Doctor, you've been tweeting about this, that beaches are mostly safe, but what we saw were not just beaches with people enjoying the water. What we've seen around the country are crowds and crowds of people along the beach fronts as well as in bars and in restaurants.
You have to remember that it's not just going outdoors that spares you from this virus. It's actually social distancing. If you are in a place where you're going to be interacting with other individuals, you're going to give the virus a chance to transmit. So it's important, though, that the outdoors are relatively safe. Nothing in this pandemic era is going to be without risk. And you have to really think about what risk you want to confer on yourself by exposing yourself to individuals. And that may be different for each person in their risk tolerance, but we shouldn't act as if this virus is not here anymore.
And just from the numbers, we know that we're not talking about a one-to-one risk here, because one person can infect 5 people or more. That was the issue with churches and other religious institutions because of the difficulty in social distancing, and that's why many churches are resisting the president's call to go back to church yesterday.
We've definitely seen what we call super spreading events that happen in churches. Churches are indoor. People have certain activities there, singing, that might not aerosolize the virus, but allow the droplets to emanate at a much higher rate. And we can see large groups of infections traced to churches. So churches have to be handled in a particular way because we've seen epidemiologically that they are ways that many people can get infected. So they are not the most safe place to go right now until certain measures are put into place to make church-going safer.
The Governor Asa Hutchinson in Arkansas was talking about the freedom to go out and about, even though their numbers have been increasing. Let's watch some of that from yesterday.
We have to manage the risk. We take the virus very seriously. It's a risk. It causes death. But you can't cloister yourself in home. That is just contrary to the American spirit. And we have to discipline ourselves. We have to manage the risk. I make the comparison with, you can be in an automobile and it's very risky, but you manage the risk by wearing a seatbelt.
Dr. Adalja, how do you manage the risk when you don't know what the data are? One of the things that was so shocking on Thursday, the Atlantic magazine published that the CDC was conflating and combining diagnostic tests with antibody tests, which give you it makes the information meaningless on both scores.
It's very important that when governors and other policymakers and public health authorities are making decisions, they're using the correct data. And when you lump together antibody tests and PCR tests that are looking for acute infection, you don't get the right information. You want to know where your state is going, where your state is. And to do that, you really need to look at the number of new cases that are being diagnosed by PCR and what the percent positivity is of those tests, because it's not necessarily the sheer number that we worry about. It's what percentage of the tests that you're sending with PCR are positive. And that's really what we want to do. And in an era where there's so much conspiracy theories about how many tests are being done, how many cases there are, this type of data just only adds, these data problems add to that conspiracy theory mindsets. We want to make sure that we have very high fidelity in the data and that states are doing this in the appropriate way, because we want people to know exactly where they are in this epidemic.
Now, how and why would the CDC combine these disparate factors? Is this deliberately to try to make it look as though we're testing more people? How does an accident like that happen?
I don't know that it's deliberate. I think that it's just people not being very careful with the data and not quite understanding that antibody tests, although they're telling you somebody was infected, they aren't the same thing as a PCR test, which is telling you who is infected currently. One is kind of looking back in the rearview mirror. One is looking at where you are now and looking forward. So you use those information, these pieces of information for very different things. And they're both valid types of information, but you can't conflate the two, or you're going to get bad information and have a decision that's not driven by the best data possible.
Dr. Adalja, as always, thank you so much.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.